Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Tracy, we all know, how many times have we heard that exercise is good for you? But the other question is, what kind of exercise, what type of training helps most, especially when you're older, say over 65? Now, that's a little bit discriminatory, isn't it? With people over 65, they're seasoned citizens.
Right.
Well, a recent Mayo Clinic study says that the best exercise is high-intensity aerobic exercise.
Well, it's not exactly the fountain of youth. Exercise, particularly high-intensity interval training, encourages your cells to make more proteins to feed their energy needs, which can actually reverse some of the aging process at the cellular level, Dr. Shives.
It all has to do with your cells? I don't quite get it. We need to talk to somebody who knows.
Here to discuss is the senior researcher on this study, Mayo Clinic endocrinologist, Dr. Sreekumaran Nair. Welcome to the program, Dr. Nair. It's nice to meet you.
Thank you very much.
Dr. Nair, it is really good to have you on the program because this is an intriguing study that you did suggesting that you can actually, well, maybe reverse the aging process. But you're an endocrinologist. You're a hormone doctor. How is it that you got interested in exercise?
Well, I'm a predominantly a diabetologist. Treat
patients with diabetes. Okay.
And one thing we realized pretty early is that you can improve insulin sensitivity or insulin action. That way prevent onset of diabetes in many people. There are studies showing that exercise alone, people who are high predisposition to become diabetic, diabetes can be delayed or even prevented by an exercise program. And another one is, of course, a caloric restriction. They are the two things which have been shown to really delay the onset of diabetes.
And exercise and diet. Exercise and keeping your weight under control.
That's right.
You can either delay it or prevent it. Diabetes.
That's right.
So what is, as Dr. Shives was saying, what do you consider to be high-intensity interval training, or HIIT, HIIT?
Well, let me tell you, another reason why I'm interested in exercise is we know that even if you have a family history of diabetes, genetic predisposition to become diabetic, most people don't become diabetic until they become older. So one of the other things we realized pretty early is almost 65% of the sugar after a mixed meal is metabolized by the muscle. And we realized that with age, you decline your muscle mass. And we also found many years ago, with age, there is also a decline of your capacity to convert nutrient energy to a chemical energy called adenosine triphosphate, ATP. That's the only form of energy cell can use it. So the organelle for doing that is called mitochondria. Then mitochondria decline with the age, and which means overall your energy requiring processes also decline. So we realize that's one of the key things happening with aging. And our early cross-sectional studies have shown that when you compare with the people who regularly exercise vigorously for a long period, more than 4 years, young and old people, when you compare them with the people who are sedentary, we found that most of these changes we are seeing in people who are sedentary older people can be almost completely reversed by this exercise program in older people.
Wow.
So that really, especially in mitochondria and insulin sensitivity, insulin sensitivity also declined with the age, that can predispose to diabetes.
Yeah, pretty amazing. But you also suggested that maybe if you had more muscle, since 65% of sugar is metabolized in the muscle, that would be a part of the regimen too.
Yeah, I think increasing muscle mass, but muscle also has to be metabolically active. That means you can prevent muscle loss by resistance exercise, but that improves the insulin sensitivity. But that doesn't stimulate, based on our recent study, that doesn't stimulate the ability of this mitochondria, which is a sort of organelle within the cell, converting my nutrient energy to ATP.
All right, so but in order to do that, that's exercise.
That's called
aerobic exercise.
That's aerobic exercise. Among the aerobic exercise, this current study we did, we want to understand what's happening at the cellular level. And so that way we compared high intensity interval training. That means you cannot do very high intensity continuously for a long period. So there is a period, interval of high intensity, then you go down and do a low intensity, then you go back to high intensity. So that's called interval training.
You go all out for a while and then you slow down.
If you can, there are various regimes of high intensity interval training. What we followed is the only 15, 16 minutes of the total exercise period. These people did high intensity biking. The rest of the period was a low intensity. And this was under supervision. We made sure that everybody did the right way. And what we found was this is associated with almost 69% increase of the capacity to produce ATP by the mitochondria in the muscle by older people. Almost 47-48% by younger people.
So then that means that you can metabolize the sugar? Is that?
Well, it's also ability, even if you burn a fuel, you have to convert that energy into ATP. We have found that if you are insulin resistant, like women with polycystic ovarian syndrome, they are very severely insulin resistant. And as a result, they can predispose diabetes, heart disease, various problems. And those people, we found that even they are burning fuel, there's an inefficiency in converting that into ATP. And what we found in the study is that, women with the PCOS, you can correct that by exercise program. So this study, we found that these capacities to produce ATP substantially increased in older people, which was lower to begin with. And that occurred because any gene expression is through proteins. And what we found was that the mitochondrial protein, it was lower in older people. That returned to pretty high level after exercise. And that's explained this increase in the capacity to produce ATP.
Should the high intensity interval training is that the best exercise for people over 65?
Well, we have to be careful about that. The point is somebody who's sedentary, they cannot really start a high intensity interval training. I mentioned initially this was done under supervision in the Dan Abraham Healthy Living Center, which is in Mayo, under supervision of a very highly qualified exercise physiologist. So older people, best advice is first they have to talk to your doctor. How can I start doing an exercise program? Slowly and steadily increasing. And preferably, if they can go to a fitness center, get some instruction from an exercise physiologist, then they can do by themselves. Otherwise it can cause injury, some of the adverse effects.
Yeah, there's no reason to have a heart attack just to try and do this, right? I mean, you got to check with your physician first.
I think
because
so.
High intensity exercise gets your heart rate up pretty high.
Very high. That's the reason. I think that way, start slowly and steadily increasing.
So what you have done is figured out actually on a cellular level what it is about exercise that it is so good. And you've also figured out that the high intensity is better than just medium intensity.
In terms of mitochondrial function, insulin sensitivity, even resistance exercise improved that. But the resistance exercise has no impact on mitochondrial function. And we also found this high intensity interval training enhanced what we call the machinery that make protein, ribosome. We found the ribosomal proteins were increased in older people when they exercise. That shows their capacities to produce these proteins increase.
All right, so it's okay it's a good idea to have a little more muscle, but in order to get the full effect and the best exercise, the best effect from exercise, you need high intensity aerobic training.
Yeah, I think probably what my patients I recommend is, yes, you had to get some instructor to introduce you into that and do 3 days a week high intensity interval training. 2 days may do the resistance training. The other 2 days do a modest walking or something. Do something every day. The worst thing can happen is
not doing anything.
Not doing it sedentary.
All right, we got to run back to the office, huh? Dr. Sreekumaran Nair, high-intensity interval training. He's an endocrinologist at the Mayo Clinic. Great study. Thanks so much for sharing it with us.
Thank you. Thank you for the opportunity.